beautiful.
Thank you.
Ladies and gentlemen, Dr.Kenji Ojima. Thank you. Thank you.
Hello everyone, my name is Kenji Ojima from Japan. I'm very honored to be here, coming to Amsterdam, and initially I want to thank Align Technology Benelux team and wonderful people. Today I want to share with you is one of the biggest, very important thing. Before going to my lecture, I want to thank John Morton all the time because I used for the Invisalign system since 2006. At this time, I just have an interest. But now, this is a reality because aligner is not only simple case, not only anterior teeth only. The Align Technology team is think about biomechanics and think about the future. Then I use a lot of the cases for the Invisalign system. Then I help for my patient all the time. Thanks a lot for the wonderful job for the John Morton and the Align team. I'm very, very respectable there. So this is my short introduction. I'm adjunct professor at University Torino, orthodontic department, and I have 3,500 cases for Invisalign system. And this is my clinic. My clinic is we have three. It's only focus on aligner orthodontic treatment. Here is located is the center of the Tokyo. If you have interesting, please visit to our office. Patient is come to my office, then they want to change smiling. Not only change smiling, want to before COVID-19. So many of the worldwide speaker is coming to my office. Then so that we take a dinner together, the wonderful Japanese food. This is our education center, Digital Aligner Orthodontic Education Center. During COVID-19 is very difficult to international lecture and very difficult to domestic lecture. At this time, we started to create. This is a studio. It's all the time, every night. Our team is streaming education. Japanese doctors, Asian doctors, international doctors. All the time we watching like this Zoom. Easy to communication for the Q&A, same as this. The many of the Japanese doctor, many of the Asian doctor, worldwide doctor, this is a totally different another competitor aligner companies. Align technology is create a road, create a field, this field, then there is reality aligner orthodontic companies. John Morton is including Align technology, then Align is more expand for the worldwide. Thanks a lot, John. And if you have an interesting, please read this our book. This long history. Initially, I started this plastic material. Just plastic, no. Including technology and experience and biomechanics, okay? Today, I want to share with you what is the Invisalign G8. Improvement to predictably in moderate severe clouding and crossbite cases, okay? That is amazing. Automatically placement of precision bite lamps for lower intrusion, okay? Third one is reduction in the likelihood of posterior open bite. So John is already tell to you, this is a very important situation AP correction. And both of sides you can see deep bite solution, optimize deep bite attachment, pressure area, pressure bite lamps, optimize support attachment on upper lateral incisor. This is amazing, okay? Have a look. Definitely both of the model is a scissors bite. How to solve? Because bite force is very strong, okay? At this time, very important thing, we have to create a space, okay? After that, we can control anything, okay? At this moment, very important thing is all CR, okay? I all the time check it. If patient different, CR not equal CR, we have to check, sometimes take a combing CT, sometimes MRI started to Invisalign treatment, okay? At this time, today, John is talking about, this is very important thing. Tooth movement at this time, we have to think initially force system. Which force is better to tooth movement? After that, the teeth, okay? But not only clean check. Clean check is very nice, but this is just simulation, okay? Doctor have to need 3 big consideration before treating. Like this position, how do you think? The same. More thin of the bone level cannot. Don't do it, okay? Take a photos, take a scanning with combing CT, then you can understood how degree to control or good. Only analysis is combing CT. Cephalometric cannot. Panoramic X-ray cannot. Only understood is combing CT data. Then go to the clean check. How degree possible? How some of the time premature contact, then another side is open bite. Yes. This patient, 44 years old, male, high canine, anterior clouding, and I want to plan extraction. Refinement time is better. Initial time not good, okay? Finally, IPR is more good for the midline correct. Of course, we do like this, but the next generation, think about airway analysis too. I totally accept for the Lamont approaching. This book is, our team is published very new one. So all of the worldwide speaker is inside for the case. The Professor Ravi and my friend is published this new book. If you have interesting, please check this book. Okay. And this is my contributors, Ravi Nanda and Professor Junji Sugawara, Chisato Dan. Thanks a lot for attending my lecture today. If you have interesting, please follow to my Facebook, my Instagram, and my YouTube channel. Thank you.
For much longer. You know, this was just 25 years. Wait for the rest of the 25 and then 50 years to come. It will be amazing. Thank you.